My name is Alberto Murino. I'm a consultant gastroenterologist at the Royal Free Hospital and honorary associate professor at University College London. I am here with Dr. Alessandro Rimondi, who is the first author of the meta-analysis that we are going to discuss today, also on behalf of our co-authors. This is entitled Outcomes and Safety of Duodenal ESD for Non-Ampullary Lesion. So Alessandro, first of all, why did we decide to go ahead with this study?
So thank you very much, Alberto, for the kind introduction. So this meta-analysis stems from our clinical need to better understand the duodenal pathology and its treatment. We are colorectal center of ESD that we adopt a universal approach for colonic polyps, but we know if we read the guidelines for duodenal polyp, the mainstay treatment is EMR because ESD is perceived as dangerous. We also know that duodenal EMR has some pitfalls in terms of adverse events. It's not exempt from adverse events, and there might be some quite a considerable amount of recurrence rate as well. We just wanted to explore what the current body of evidence highlights regarding ESD in the duodenum, knowing that the previous meta-analysis was from 2019. We also know that in recent years, ESD has made a huge step forwards in terms of safety with some newly developed technique, just like pocket creation method, sites, traction, that improve the safety of the procedure, and that's why we wanted to understand better.
And this is very interesting because in 6 years' time we probably had more publication, and the question is whether this new body of evidence has added something new to the previous meta-analysis.
So we searched 3 databases and we gathered a considerable amount of studies. So in the previous meta-analysis it included 7 studies, all coming from Asian centers, whereas in our meta-analysis we have 54 studies, and some of them there is some initial experience even from Western centers. We want to gather as much as information as possible, so we included all non-ampullary lesion, epithelial and submucosal, and we gathered 3,672 lesions, and in the paper you will find some sub-analysis on the population. When it comes to the specific outcomes, in the previous meta-analysis what was striking, it was a 15% rate of intraprocedural perforation. In our meta-analysis, we still have very good results in terms of effectiveness, at 98.1% of en bloc resection, 86.3% of R0 resection that were somehow similar to the previous one. But what is striking is that the intraprocedural perforation is at 8.5%, suggesting that the technique has improved. And there is also, we report a 2.0% risk of delayed perforation, a 3.8% risk of delayed bleeding, but overall there is a low risk for surgery that stands at around 1.2%. This adds to the current body of evidence that see how endoscopic management of adverse event can lead to very low rate for surgery, and we know that surgery in that area could be quite extensive.
Okay, so that's very interesting because it means that essentially all over the world we're doing more ESD that is still very effective but with less complications. So overall we have improved a lot, but we don't of course recommend that duodenal ESD are performed in non-experienced centers. And taking from there, what is the future perspective in this field?
Yeah. One problem of our meta-analysis is that much of the evidence comes from really experienced and renowned centers, so there might be a problem of reproducibility of the results of the meta-analysis. We need to better understand the indication of ESD in the duodenal pathology, meaning that we don't have reliable optical diagnosis in this setting as it happens in the colorectal lesion. So overall we need a better understanding of the indication for duodenal ESD. We will also recommend that duodenal ESD shall be performed only by a very proficient centers in ESD, well established, with a very strong and established HPB service, just because of the potential danger of this technique.
Thank you so much, Alessandro. So we invite all the readers to read our meta-analysis, and we wish to thank once more our co-authors and of course gastrointestinal endoscopy for accepting this meta-analysis for publication.
Thank you very much.
Thank you very much.